Welcome to Top Doc Interviews. In this series, we'll be interviewing local top docs in your community to learn more about them, their practice, and events shaping healthcare and medicine. The goal of the series is to educate, inspire, and have some fun along the way. So if you'd like to be notified when we upload a new interview, just hit the subscribe button below. From all of us at Optima Surgical, we thank you for watching and we hope you make it a great day. Today is Tuesday, April 28th, and the very first episode of Top Doc Interviews. Today I'll be speaking with orthopedic spine surgeon Dr. Justin Field to get his take on how the coronavirus has impacted him, his practice, and his patients. Dr. Field's a board-certified, fellowship-trained orthopedic spine surgeon practicing at Desert Institute for Spine Care in Phoenix, Arizona. Dr. Field specializes in endoscopic spine, minimally invasive spine, and motion-sparing spine surgery techniques. Dr. Field's been recognized multiple times as a top doc in the Phoenix magazine, and this year he was the top vote getter in his specialty of orthopedic spine surgery. Dr. Field, welcome.
Thanks for the introduction. That was nice. Thank you.
Of course. Appreciate you taking some time to jump on the Zoom call with me, and I know how busy you are, so let's jump right into it. So on everybody's mind is this coronavirus pandemic, and this Friday is May 1st. And what that means in Arizona is that as an orthopedic spine surgeon, you can begin resuming elective procedures. So my question is, what are you telling your patients right now? And what message do you have for any patients out there that have had their elective procedure postponed?
It's been, certainly a strange, last 6 to 8 weeks navigating what we can do for patients. And so we've certainly done more urgent cases, patients that have weakness, numbness, severe debilitating pain that just can't wait till, May 1st. And so we have done some of those types of cases, but we certainly have a lot of patients who were willing to, as well, wait until, things, potentially were going to calm down. I think we're lucky here in Arizona that I believe we're past any sort of peak. I think we were well prepared as far as, hospitals bracing themselves for an influx of patients, sick patients with COVID-19. And so luckily, we really didn't have that, terrible amount of patients that were, crowding the hospitals and taking up, ICU beds and whatnot. But now, we have a lot of patients who are excited to be able to proceed with surgery. At least for spine patients, I think they're very safe to go to any hospital at this point. I do operate at a couple of different hospitals. One of them is Honor Health Shea Hospital, which was, a hospital that has an emergency room, a hospital that was equipped for these potential influx of corona patients. But they are absolutely a go starting this Friday on elective procedures. And I think it's a very, a great, safe place to go to. The other hospitals that I'm at are Oasis Hospital and Core Institute Specialty Hospital. And that's actually where I've been doing a lot more of my more urgent cases the last 6 to 8 weeks, just because there's not an emergency department there. There's not a floor for sick patients and whatnot. So I just would tell patients out there it's okay and it's time to be able to get help, and they shouldn't feel apprehensive about entering hospitals and getting the necessary surgery they need.
Yeah, that's certainly welcome news for any patients out there that are suffering during this time, unable to get their procedure done. What protocols are hospitals putting in place to ensure patient safety, staff safety, and really safety of anybody visiting the hospital?
Yeah, that's a great question, because, what I would say is that some of the things that hospitals have implemented is, every patient, every doctor, every nurse, every radiology and surgical technician, and all the reps from all the companies going into these hospitals, you get your temperature taken. They ask you the necessary questions, like, have you had any fever? Have you had any cough? Been around people like that? And so, certainly they're stopping it at the door of anybody that potentially could be under the weather. The other thing is they're limiting patients' families to be coming in and just sitting there in a waiting area. I think that's something that will continue to happen going forward. It's probably a good idea. I think it's sweet that family members are in a waiting area waiting for their loved one that's getting surgery. But it's not maybe necessarily the best way to spend your time. I always try to tell my patients' families, if there's any prescriptions to get, let's give them the prescriptions now so they can make their way to the pharmacy. I say, go get some coffee, get some lunch, go off campus. I'll call you, when we're done with surgery, and you can come back in and just, so you're not just sitting there for hours. And so that's one thing is, again, they're limiting, the people being able to wait in a waiting area. And then, the other thing is just, again, certainly looking at patients' comorbidities. And we've always, before they get spine surgery, have somebody cleared by the internal medicine doctor and any other subspecialists like cardiologists, pulmonologists, and whatnot. But I think this is something that at this point we really, have these things more finely tuned and up to date. And then finally, at least right now, they're asking us to have every single patient get COVID tested with there's an actual test that says whether you have it or not. And then of course there's the antibody test. But right now I think most patients are getting the COVID test to see if they actually have the current coronavirus. And of course, if they had that, they would be canceled. So they're getting that from their primary care doctors as well.
Yeah, I think you bring up a couple of really good points. One, obviously, any patients that test positive for coronavirus will not be admitted for surgery. And two, you and your colleagues in the medical community have always had to run patients through a series of different tests to ensure that it's safe to proceed with surgery. And it sounds like coronavirus will be another step in that protocol. How quickly are these coronavirus tests coming back?
There's a test that we're using at one of our surgery centers where you're able to get the test back within 15 minutes. This is not fully available to everyone yet. So, you just have to call your primary care doctor to understand which test to get. So there's other ones that are taking several days to come back, but they're getting better and better and more sensitive and specific. So it's out there. And I think the more people that, get tested, I think we all feel better. I think it's going to end up showing that, incredible amount of people actually have or did have the coronavirus, were asymptomatic. And I think that'll make people feel better about moving forward to getting back to work and whatnot.
So even with these protocols being put in place by you and the hospitals, there's certainly going to be a number of patients that are going to want to avoid going to the hospital, want to avoid having their procedure done. I guess my question is, what message do you have for spine patients, and is it safe for them to delay having their procedure done?
I would say that, if this is a condition where you have stenosis, where the nerves are being pinched, and it's just impeding your, ability to walk perhaps, longer distances, and you're okay with that, maybe that is something that can wait a little bit longer. But if you have, pain, weakness, numbness down one of your limbs because of a particular nerve being pinched, or have such bad, impingement on your actual spinal cord, that's just not something that should wait. And the dangers of waiting is that you can get permanent, impairment of a nerve root, permanent, permanent impingement on your spinal cord can cause something called myelopathy that even if you operate on it and it's too late, it just never gets better. So there is certain conditions where, certainly doing surgery sooner is better than later. And I can just tell you that, with the surgeries that myself and my partners have been doing, especially over the last 6 to 8 weeks, all the patients have come out of it very healthy with no additional illnesses or anything like that. And so they've been very safe. And so certainly going forward, I that it will continue to be safe.
That makes sense. Obviously, some conditions are more urgent, and some others you can sort of live with. Okay, so switching gears a little bit, it's been 48 days since Governor Ducey declared a state of emergency here in Arizona. And my question to you is, what are some lessons you've learned in these past 48 days that you're going to maybe incorporate into your practice moving forward?
Yeah, I mean, a lot of things for sure. One is I thank goodness, I feel like at Desert Institute for Spine Care at DISC, we have always been good about running our business, taking care of our employees very well. And so we've always been on top of that. We have an amazing office manager, Stephanie Helston, who's just aware of and always, on top of it on all the current laws and current things that we need to be on top of to succeed. And so you have to be willing and able to adapt to new situations like this. And so one of them was telemedicine, something I'd never done before, but we were able to see patients just like you and I are doing on the Zoom and talk about their condition, new patients, follow-ups, post-op patients. We're able to look at, their incisions and all that and assess things after surgery. And so that was something we were able to do very quickly. So it was a nice way to keep the practice going, and not abandon our patients in their time of need, especially the patients that had been operated on in December, January, and February. They continue to need to be seen and looked after, closely. That was one thing. The other is just, I think, just to not panic, to not over analyze everything, and to continue to make yourself available to people, and let them know that you're there, you're willing and able to work and see patients, especially patients that have urgent conditions. And so that's something that we made sure that other offices knew, is that we although obviously had to cut back a lot, we were there for our patients and there for other doctors who need to get their people to us.
That's really great. I love hearing stories about how companies and practices like DISC have always made it a point to take care of their employees. So kudos to you guys. I also think it's neat how telemedicine's made its way into your practice. It certainly sounds like a useful tool for you and your patients. Okay, so here's my final question surrounding the coronavirus pandemic. Last year in 2019, healthcare was 17.8% of GDP, large portion of that coming from elective procedures. And today I read that in March alone, and this is devastating, more than 42,000 healthcare workers lost their jobs. So my question is, in your opinion, what impact will this coronavirus pandemic have on healthcare, and how do you see healthcare evolving when this is all said and done?
I am hopeful because we'll have future years where the influenza, the flu as we know it, we'll have some devastating years in the future. I mean, there is years where it's over 80,000. I think it's usually around 50 to 60,000 deaths a year from the flu here in the United States. So, I mean, these numbers, they are high. And now that there's a coronavirus, and perhaps there'll be different strains of it in the future, that I just think we'll all be more prepared for in the future, and may not close down like we did, because it was devastating to the nurses not getting their hours, anesthesiologists in big groups getting furloughed or getting paid, getting half pay and nothing they could do about it. And all the, people that work at hospitals, all the technicians, not getting their hours. That is very, very difficult, especially if you're the breadwinner of the family and you're not getting, you're making even just 3/4, of what you're making before can be devastating, per month. And not everybody gets, this PPP loan or grant and gets these other grants. It's just such a short-lived thing that gets you through for a couple of months. So I'm hopeful that in the future, everybody, will feel more prepared and also feel more comfortable to continue to proceed with taking care of patients who need total knees, need total hips, rotator cuff repairs, ACL repairs, and of course, spine procedures.
Yeah, it's really great to hear your optimism, and I agree. I think this pandemic will not only make us stronger, but like you said, better prepare us for adversity in the future. And at least for me, it's been nice seeing people sort of slow down and appreciate the small things in life during this time. Well, Dr. Field, that's it. I appreciate you taking some time to join me on this call. Again, congratulations on another Top Doc nomination and for being the top vote-getter in your specialty. Appreciate your time. Hope you have a wonderful evening and look forward to seeing you again soon. Thanks.
You, Mike Budak. I'll talk to you soon.